I'm passionate about smiles because it changes people. It's really that simple. When you're feeling confidence about yourself, obviously you're going to do better in everything you do, whether it's work or school or relationships. We are definitely family-oriented here at Rocke Orthodontics. We have a section for the little brothers and sisters. We have a game area. And I think it's a real pleasant atmosphere for people to come to. My specialty at this point is using Invisalign for both adults and teens. I feel it's the biggest change and biggest positive change in orthodontics in the last 20, 30 years. And I think it's the future of orthodontics. My patients love Invisalign. They come into the office in a great frame of mind. They can see the progress, and it's very exciting.
It was super easy. You wear them for about 20 hours a day. You don't even notice that they're in. You just take them out to eat, pops right in, pops right out, so really easy.
So did they tell you weren't a candidate for Invisalign Teen? Me too, but I came to Dr. Rocke and he told me I was a candidate.
The experience that I've obtained over the last 10 years, the 200-some cases I've treated, regular dentists and some orthodontists don't have the experience, so they've had the experience with fixed appliances, and that's what they're going to recommend, where we think we can treat a large number of the cases of the patients with Invisalign. If the patients have been told no before, I think that if they come here, we can probably tell them yes, that they are candidates for Invisalign. I've handled everything from surgery cases to very minor treatment over the last 35 years. And with my confidence in the appliance that I use, I can treat cases that maybe other doctors would think would need surgery, headgears, this type of thing, which we do not use at all. Sometimes we'll treat some Invisalign patients with a short period of fixed appliances to accomplish the movements that Invisalign doesn't do very well. Then we go to Invisalign to finish them up, and it just works great. Better, easier, faster, and cleaner, because we don't have the problem of brushing around braces. It's removable. It's nobody knows that you're being treated orthodontically, which is important for older teenagers and adults, of course. And of course, the hygiene issue is very important. It's just much easier to eat because you just take them out, put them back in. We've also used functional appliances which change skeletal patterns and muscular patterns. It's been amazing. I think the rapidity of treatment, how fast we're able to treat cases with fewer appointments, due in large part to space-age metals that we use compared to 30 years ago. We can let the patients go 6 to 7 weeks with the appliance working all the time and still finishing them faster than we did maybe 30 years ago. To keep current, we go to a lot of seminars to find out what other doctors are doing, how they're doing it, how we can improve the technique. We try to make it as easy financially for the patients as possible. The payments are made over roughly a 24-month period, and there is no interest charged. Orthodontics is long-term gratification, and after a period of a year, year and a half, maybe 2 years, to pull out the old pictures where we started and to see where these patients are now, it's very gratifying. The more severe situations, it seems the more positive the influence of giving a person a beautiful smile. I do like a challenge, and it goes back to the confidence I have in the type of braces that I use. I feel we can do much more severe situations in a shorter time than many of the other standard type of braces require. So that gives me a huge level of confidence that I can get the job done. We've had tears of joy in the past, having accomplished producing nice smiles.
I was kind of embarrassed to smile, and people would point out your teeth, and it just wasn't very fun.
He's really nice, and he talks to you nice, and he doesn't, like, he tries not to hurt you when you have, like, braces or expander on, and he treats you like family.
It's a good feeling. I like smiling now, and so it's fun.
We cater to young ladies and men that are going to be married, so when they have their wonderful pictures taken on their big day, they'll be able to smile and feel very confident and very proud of what they've achieved.
It's just one of the most important days of my life, and I want to look back at my pictures in 10, 20 years and love them still. So
I stand behind my work and my practice because of the experience that I've had over these last 35 some years. The number of cases, the varying amount of difficulty of cases, and my ability to get these corrections made orthodontically. I care about each and every patient. I see them every visit and call them as necessary, and it's a very personal thing with me and my patients. I love making smiles beautiful.